Hey there, it's me again. Today, I will introduce myself as a classification. Pharmacologically, I am ergot derivative, and there are two drugs under me that I want you to know, dihydroergotamine and ergotamine. Now let's talk about dihydroergotamine first. The generic name is dihydroergotamine, the brand name is Migranil, and the chemical name is this. For ergotamine, the generic name is ergotamine, the brand name is Ergomar, and the chemical name is this. For drug classification, therapeutically I'm classified as anti-migraine, and pharmacologically I'm classified as ergot derivative. My pregnancy category is category X, meaning to say, dihydroergotamine and ergotamine drugs possess danger to developing fetus because they cause contractions of the uterus, fetal distress, and miscarriage. Also, evidences show that these drugs are excreted in breast milk and has caused symptoms of ergotism or vomiting and diarrhea in infants. Now let's talk about the mechanism of action. I contain vasoconstrictor and anti-migraine action. By stimulating alpha-adrenergic receptors, I cause peripheral vasoconstriction if vascular tone is low. However, I cause vasodilation in hypertonic blood vessels. At high doses, I am a competitive alpha blocker. In therapeutic doses, I inhibit the reuptake of norepinephrine. As a weak antagonist of serotonin, I slow the increased platelet aggregation caused by serotonin. In treatment of vascular headaches, I may cause direct vasoconstriction of the dilated carotid artery bed while decreasing the amplitude of pulsations. My serotonergic and catecholamine effects also appear to be involved. My effects on blood pressure are minimal. My vasoconstrictor effect is more pronounced on veins and venules than on arteries and arterioles. Although both dihydroergotamine and ergotamine drugs as ergot derivatives possess the same mechanism of action, they have some differences when it comes to pharmacokinetics. For dihydroergotamine, it is incompletely and irregularly absorbed from GI tract. Its onset of action depends on how quickly after headache drug is given. 90% of the dose is plasma protein bound. It is extensively metabolized, probably in the liver. 10% of the dose is excreted in the urine within 72 hours as metabolites. The rest is in the feces. For IV route, the onset is 5 minutes, the peak is 15 minutes, and the duration is 8 hours. For IM route, the onset is 15 to 30 minutes, peak is 30 minutes, and the duration is 3 to 4 hours. While for intranasal route, the onset is rapid, the peak is 30 minutes to 1 hour, and the duration is unknown. Ergotamine is rapidly absorbed after inhalation and variably absorbed after oral administration. Levels peak in 1/2 to 3 hours. Caffeine may increase the rate and extent of absorption. The drug undergoes first-pass metabolism after oral administration. In terms of distribution, it is widely distributed throughout the body. It is extensively metabolized in the liver, and part of those, about 4%, is excreted in urine within 96 hours. The remainder is presumed to be excreted in feces. For oral route, the onset is variable. The peak is 30 minutes to 3 hours, and the duration is variable. For sublingual route or inhalation route, the onset is variable, the peak is unknown, and the duration is variable. For rectum, the onset is unknown, the peak is unknown, and the duration is unknown as well. The half-life is 2.7 hours.
Let's now discuss for my indications. An ergot derivative drug is indicated for the prevention or abortion of migraine or vascular headaches. Since I have two brand names, which discussed earlier, I will explain to you the indications of each drug. For the dihydroergotamine, it is used for rapid treatment of acute attacks of migraines in adults. One spray of 0.5 mg in each nostril may repeat 15 minutes for a total of 4 sprays or 1 mg IM at first sign of headache. Repeat in 1 hour for a total of 3 mg or 2 mg IV and do not exceed 6 mg per week. For the ergotamine, used for prevention and abortion of migraine attacks in adults. 1 tablet sublingually at the first sign of headache. Repeat at 30-minute intervals for a total of 3 tablets or 1 inhalation at first sign of headache. Repeat in 5 minutes to a total of 6 inhalations per day. So if there are indications, of course, contraindications and cautions are also present and are needed to be avoided while taking me. So I am contraindicated in patients who are hypersensitive to drug, or to ergot alkaloids. In pregnant or breastfeeding women, and in those with peripheral and occlusive vascular disease, coronary artery disease, uncontrolled hypertension, sepsis, hemiplegic or basilar migraine, severe pruritus, malnutrition, and severe hepatic or renal dysfunction. Also, avoid using me in patients with uncontrolled hypertension or within 24 hours of 5-HT1 agonists, ergotamine-containing or ergot-type drugs, or methotrexate. After taking me, patients will experience some side and adverse effects that may affect the status of their body. So the following side and adverse effects are: first, in the central nervous system, the patient may experience numbness and tingling in fingers and toes. For the cardiovascular system, the patient will have transient tachycardia or bradycardia, precordial distress and pain, and increased arterial pressure and localized edema. In the digestive system, the patient will have nausea and vomiting. For the musculoskeletal system, the patient will have weakness in legs, muscle pain in limbs. Lastly, for the integumentary system, the patient will have pruritus. We all know that the nurse has a big role while the patients have their therapy in the hospital. So I have here a list on the nursing responsibilities before, during, and after taking me. So before, the nurse needs to assess for contraindications or cautions such as any known allergies to any component of the drugs to avoid hypersensitivity reactions, history of MI, CAD or hypertension which may be exacerbated by the drug, pruritus or malnutrition which could be exacerbated by ergot derivatives, hepatic or renal dysfunction which could alter the metabolism and excretion of the drug, and current status of pregnancy and lactation which could be cautions to the use of these drugs. Also, the nurse needs to perform a physical assessment to establish baseline status before beginning the therapy, determine drug effectiveness, and evaluate for any potential adverse effects. Assess the patient's neurological status, including level of orientation, affect, and reflexes, to evaluate CNS effects of the drugs. Monitor for complaints of extremity numbness and tingling to identify effects on vascular constriction. Inspect the skin for localized edema, itching, or breakdown with ergot derivatives to evaluate potential dermatological effects. Assess vital signs, including PR and BP. Obtain an electrocardiogram as appropriate to evaluate cardiac status for changes. Lastly, the nurse needs to monitor the results of laboratory tests, including liver and renal function tests, to determine the need for dose adjustment and identify possible toxic effects. During the therapy, the nurse needs to administer the drug to relieve acute migraines because these drugs are not used for prevention. Also, the nurse needs to administer at the first sign of a headache and do not wait until it is severe to improve therapeutic effectiveness. Arrange for safety precautions if CNS or visual changes occur to prevent patient injury. Provide comfort and safety measures such as environmental controls and stress reduction for the relief of headache. Provide additional pain relief as needed. Monitor BP of any patient with history of CAT and discontinue the drug if any sign of angina or prolonged hypertension occurs to prevent severe vascular effects. Offer support and encouragement to help patient cope with the disorder and associated drug regimen. Lastly, provide thorough patient teaching about the therapy to enhance patient knowledge about the drug therapy and to promote compliance. After the therapy, the nurse needs to monitor the patient response to the drug, monitor for adverse effects, evaluate the effectiveness of the teaching plan, and monitor the effectiveness of comfort measures and compliance with the regimen.